Come on. Take me off this roller coaster. Hey. I don't wanna ride no more. 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 Let me off this roller coaster. I don't wanna ride no more. 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 Every time I turn on my radio, it's the sex lies, the misogyny show. All day, every day in my ear. If you keep your clothes on, then they call that rare. Vulgarity, they raising the ante. It's the road less traveled if you wanna be classy. I look at it all and I'm completely inspired to answer all negativity with a song and a smile. And I'ma stand up for what I believe in, and I don't care who thinks I'm pretty.
Hi guys, I haven't done a YouTube video in quite some time, so welcome back. Alright, so this time I want to talk about hyperthyroidism, which is also known as Graves' disease. And I want to talk about it because I am currently struggling with it. So I want to talk about it from a woman's point of view and from a black woman's point of view. So I was diagnosed with this disease in September of 2018. And at that time in my life, my mom had just passed away in May of 2018. So I ended up losing like a lot of weight, and I was kind of like having like anxiety and just, you know, a bunch of those things that I just really felt like I was depressed, and that's what the problem was. But what happened was my heart rate went up like drastically, and I had to go to the ER. So upon going to the ER, running a bunch of lab tests, they found out that I have what they call hyperthyroidism. So in the moment when I went to the hospital, the ER, I was what they call a thyroid storm. I was in a thyroid storm. So they got it controlled and got me out the hospital and all of that good stuff. And I started seeing, of course, an endocrinologist, and she put me on medication. She put me on a medication called methimazole and a medication called metropolol, something like that. I can't pronounce it, but I'll put it in the comments. So she put me on those two medications, and for a while, those two medications were working for me. So I was gaining my weight back. I was getting the appetite back and everything, because all of the symptoms that I had at first were like the increased heart rate. I couldn't sleep at night. I had insomnia. I lost a lot of weight. Like the crown of my hair was thinning. I ended up having to get my hair cut back in that around like in the beginning of 2019. My hair was cut. And my hair was like down the middle of my back before then. But it's just like these different diseases and how they affect you just do stuff to your body. So the thyroid gland is right here outside of your voice box. And what I have is an overactive one. So the hormones that it releases into my bloodstream are too many. So and those control your metabolism and things like that. I wasn't a heavy girl, but I normally weigh about 170, and I was comfortable there. You know, I had a little hip, little piece of booty, just a little piece. You know, us black girls, we gotta have that little piece. So right now I am about 140, so I'm way below my normal weight, and of course I'm not happy about that. I need my little piece right on back. Okay, so anyway, so I took the medication for as long as I could or whatever. But of course, I also think that life was happening to me. So when life is happening to you, life can trigger some illnesses. So life began happening. So stuff was going on with family, stuff was going on with friends, stuff was going on with relationships, stuff was going on with children. It was just like a lot of stuff started coming at me. So at the end of like the tail end of 2020, I started getting sick again. I went back into the losing the weight, the heart palpitations, the insomnia. And then this time I had like heat sensitivity. So normally I can handle heat for no problem, but now it was just like heat was just driving me crazy. I had anxiety. I was like bitchy, like, to be honest, and just like didn't even know why. So I'm just like, oh no. So what ended up happening, I have to go back to the endocrinologist, and this time they increased the medication. So at first I was taking like a low dose of the medication. So now they've had to increase it to like 20 milligrams. But I've seen other videos talking about this, but they're not telling you about the medication side effects. The methimazole, when it was increased, it also changed my menstrual cycle. I was having a menstrual cycle like every 2 weeks, which is horrible. I am 43 years old. No, no. Then also it changes your libido. It could be non-existent, which of course I'm 43, and no, no, my children are grown. So yeah, those are some things I want working and working properly. So it was just like I didn't understand what was going on, and then of course the heart rate was scaring me. So the increased heart rate is always what sent me to the ER. So it is now July of 2021. I've been in the ER within the last 2 months, probably 4 times. Yeah, y'all don't want to see my medical bills. Yeah. Yeah, anyway, so what's happening is I'll have like these real like strong hot flashes, and then my heart rate will go up. So I'm monitoring my heart. I have like one of those little bands. I have the app on the phone, all of that, but you can feel when your heart rate is racing up. You can feel it. It's like you're running a marathon and you're sitting down just like this. So I could be asleep and it'll shoot up. I could be sitting here on my computer, it'll shoot up. I could be doing absolutely nothing and it'll just go crazy. So it's just been doing that, and it's just been off the chain. So the endocrinologist suggested I should have a radioactive iodine treatment. I was like, oh, okay. So she explains to me that basically I drink this substance, it's radioactive, and it'll destroy my thyroid, but I'll have to be alone for about 72 hours by myself because my body, of course, it becomes radioactive. So I couldn't be around people. But in order for me to do that, I would have to be off my medication for at least a month and then go into it. So we tried that. And of course, where did I end up? In the ER. I went into tachycardia. It's scary as hell. Yeah, so me coming off the medication for a period of time does not work for me either. So currently I'm back on the medication, but I have symptoms every day. Today is July the 7th. My heart rate was off the chain today. I was texting my aunt, like showing her the screenshots of me checking it, and I was doing nothing. Had a bad night last night, didn't get any sleep. Just insomnia is just off the chain. Of course, I tried some holistic things. I tried different teas. I take a lot of vitamins. I take sea moss. I take iron, vitamin D. I take probiotics. I'm real good about my vitamins, so I'm definitely doing that every day. But nothing was seeming to help me. I'm a crystal seller, so I sell crystals. So this crystal that's on my neck is lapis lazuli, and this is a good crystal for thyroid disorder. So I do that too. I wear my crystals. I do everything that I possibly could, but it just kept getting worse and worse and worse. So now I have opted to have a thyroidectomy. So I'm going to keep documenting about this and how I'm going with it. So I have my surgery will be on the 21st. Again, today is July the 7th. So I have a series of appointments leading up to that. I have a clip from the doctor that I had the meeting with about having the surgeon. So I'm going to insert that in here as well. So I just want to bring some awareness to this disease. If you all, when you get your physicals and stuff like that, if you're thin, if you're one of those people that can eat a bunch of stuff and never gain weight, or if you're a person that notices you have like something enlarged here, and sometimes you'll notice that maybe you get like choked up a little bit, because I would get choked up like just like talking or stuff like that, or sometimes you'll notice it's hard for you to breathe or swallow or something like that as well. You pay attention to that. And also, if you're a person that holds weight and you know you're not like eating a million things every day and you're just holding weight, sometimes you can have a underactive thyroid. So definitely get your thyroids checked. The labs for that are TSH, a T3, and a T4. So definitely get those checks, men and women. I definitely suggest you get those checked. So, okay, this is part 1 of my journey. So I'm going to document my upcoming appointments, onto my surgery, my recovery, all of that. With the surgery, they will have to cut my neck, which I was not looking forward to. Was not looking forward to that, of course. But they will have to cut my neck, and they're going to go in there and they're going to take my entire thyroid out. And I will still have to take medicine the rest of my life, because now with my thyroid being completely gone, they have nothing to control my metabolism. So I'll probably be on a small dose of a medicine called Synthroid, and they give you the medication based upon, like, that's like your height, your weight. So I am 5'9.5", and right now I'm 140, but I would like to go back to at least 160. I just need my booty back. I do. But all right, y'all.
Certainly, you know, I do a lot of thyroid surgery, so I mean, it's we make a little transverse incision here. There's going to be a little scar there, and it won't be terrible over time. We try to use one of your skin creases. Everyone kind of has some transverse creases there, and then we remove the entire gland, and then you won't have the thyroid hormone, you know, just showering
she told me
your
I'll
body.
still have to take medicine
You'll
the
need
rest
it,
of my life.
but it'll be kind of a lower, kind of a normal dose. Most of my patients that I remove thyroids for cancer and things like that are in Synthroid afterwards, levothyroxine, and they actually feel a lot better. They tell me, you know, Dr. Swinson, you know, I actually feel a lot better without my thyroid.
Yeah, because I don't feel normal, or I'm afraid to do stuff like it's summer and like just to go be active with my niece and nephew or something. Like my heart rate's like up and down like crazy. So
and for every thyroid operation, I always put people in the hospital, even though you might feel like going home, but especially you, because there's going to be a lot of changes after we do the thyroid surgery. I mean, immediate. You know, you're going to have some tachycardia, your pulse will race, and so we definitely want to monitor you in the hospital until you kind of come through it. So but the operation doesn't take more than maybe 40 minutes. Not.
So as you can see behind me, I'm at the clinic. So today is July 9th. Today is my medical clearance appointment. So I'm going to see my primary care doctor for a medical clearance to have surgery. So I don't know if he'll agree to be on camera, but if he will, I'll definitely pop him in. But if not, I will let you guys know what happened when I come out. Yeah, the sun is like so in my face, but my hair is so cute. I don't look like I got grown kids. Praise God. I am waiting for the doctor, of course. The doctors are never on time. Never. My appointment was for 8:45. It is now 9:30. Good old healthcare. I ain't gonna trip though. I ain't gonna trip because I know it's a lot going on. It's a lot of people out there, and this the clinic also has an urgent care here, so I'll be patient. So it's about 7 a.m. on July 13th, and this morning is my ultrasound back there in that place. So yeah, still have some restrictions in place, so I just checked in. There's quite a few people in there, so me personally, I'm going to go sit in my car for now. But yeah, so today will be the ultrasound of my thyroid gland, and I'll probably wrap this video up after that, because next Wednesday on July 21st will be the actual surgery. So I will come back and let you all know how everything is going from that. Also, when I mentioned the THC and stuff like that in my previous video, of course, I am not a medical professional, so please don't do things just because I said that I do them. Do what works for you, and also make sure that you consult with your medical professional. And also, when it comes down to this thyroid thing, make sure that you are with a medical professional that you trust. I went through 3 endocrinologists and a couple of even primary care physicians because I want to be totally comfortable. I want to feel like I'm getting the attention, the care that I need. I want to feel like that you're answering my questions effectively. And when I don't get that, no, I feel like my medical insurance, I'm paying for it. So I feel like I should be treated a certain way. And yeah, when I'm not getting that, I move on. Yep, I sure do. So I encourage y'all to definitely consult with your medical professionals, get second opinions, everything. And again, if you're one of those people that are holding weight and you ain't eating like that, you losing weight, if your hair falling out, if you feeling like you going through the change and you don't think it's time, or the heart palpitations, if you anxiety, if you moody, well, y'all go get y'all checkups, get those labs done. You just never know. Like, yeah, you just never know why something is causing something. So definitely research that stuff and talk to your medical professionals, y'all. Please talk to them, please. Somebody that you trust and that's really gonna talk to you. You can Google, you can YouTube, you can WebMD till you blue in the face, but the reality of it is you still have to work with the medical professionals. Yeah.